Welcome back to Calm Mind and Healthy Body, our channel. The Oropouche virus is an emerging arbovirus that has recently garnered attention due to its significant impact on public health. First identified in the 1950s in South America, this virus is primarily transmitted by mosquitoes, particularly the Culicoides species. While it has been known for decades, recent outbreaks have raised alarms, highlighting its potential to cause widespread illness. The Oropouche virus is associated with symptoms such as fever, headache, and joint pain, sometimes leading to severe complications. The unprecedented scale of its spread makes the current situation particularly concerning. In recent years, there have been reports of outbreaks in various regions, including parts of Brazil and neighboring countries. These outbreaks have significantly affected local populations and raised concerns about the virus's potential to expand into new territories as climate change alters mosquito habitats. Understanding the Oropouche virus is crucial for public health preparedness. As we delve deeper into this topic, we will explore its transmission, symptoms, and measures to combat this emerging health threat. By staying informed, we can better protect ourselves and our communities from the risks posed by the Oropouche virus. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. What to know about the Oropouche virus? The Oropouche virus, often called sloth fever, is an arbovirus belonging to the Oropouche Virus genus. It is primarily transmitted through the bites of infected mosquitoes, particularly those from the Culicoides genus. This virus can also be spread through contact with infected bodily fluids, making it a public health and safety concern. Infected individuals experience various symptoms, including fever, headache, muscle and joint pain, and fatigue. While many cases are mild and self-limiting, some patients may develop more severe complications, such as neurological issues or prolonged illness. The potential health impacts can be significant, especially in vulnerable populations, highlighting the need for awareness and preventive measures. The Oropouche virus is also known by alternative names, including Oropouche virus fever, which reflects the fever-like symptoms associated with the infection. Understanding the basics of this virus is essential for recognizing its symptoms and transmission methods, enabling individuals and communities to take proactive steps in preventing its spread. As we learn more about the Oropouche virus, staying informed is critical to safeguarding our health. The 2024 outbreak. As of 2024, the Oropouche virus has seen a significant resurgence, with reports indicating thousands of confirmed cases across several regions in South America. Countries such as Brazil, Peru, and Colombia have been particularly hard hit, with health authorities documenting over 10,000 cases in the first quarter alone. This alarming spread has raised concerns about the virus's potential to affect neighboring countries and even reach new territories. The implications of this outbreak for public health are profound. The rapid transmission of the Oropouche virus poses a challenge for healthcare systems already strained by other infectious diseases. Increased hospitalizations and the potential for severe complications necessitate a coordinated response to manage resources effectively and care for affected individuals. In response to the outbreak, governmental health agencies and international organizations like the World Health Organization have mobilized resources to combat the spread of the virus. Initiatives include public awareness campaigns, mosquito control measures, and enhanced surveillance to track the virus's transmission. These efforts aim to mitigate the outbreak's impact and protect vulnerable populations, emphasizing the importance of community engagement in preventing further spread. As the situation evolves, ongoing vigilance and collaboration will be crucial in addressing this emerging health threat. How to stay safe? Preventing Oropouche virus infection primarily involves avoiding mosquito bites, the primary transmission method. Individuals can take several practical measures to protect themselves. Wearing long-sleeved clothing and long pants, especially during peak mosquito activity times, can significantly reduce exposure. Additionally, using insect repellent containing DEET or picaridin on exposed skin is highly effective. Installing screens on windows and doors can help keep mosquitoes out of living spaces, and using mosquito nets while sleeping can provide extra protection. Community awareness and education play a vital role in preventing the spread of the Oropouche virus. Local health departments can organize workshops and distribute informational materials to educate residents about the virus, its symptoms, and preventive measures. Engaging the community in cleanup campaigns to eliminate standing water, where mosquitoes breed, is also essential. Staying informed about local outbreaks is crucial for personal safety and community health. Following updates from health authorities and reputable news sources can help individuals understand the current risk levels in their area. By taking these preventive measures and fostering community awareness, we can collectively reduce the risk of Oropouche virus infection and protect our health and well-being. Recent cases in Europe. The Oropouche virus has recently made headlines in Europe following the tragic deaths of 2 young Brazilians who were visiting the continent. These cases have raised significant concerns about the virus's potential to spread beyond its traditional boundaries. Investigations revealed that the individuals contracted the virus while in Brazil and subsequently traveled to Europe, highlighting the risks associated with international travel and the movement of infected individuals. The arrival of the Oropouche virus in Europe underscores the importance of understanding how such viruses can adapt and spread in new environments. Factors such as climate change, increased travel, and the presence of suitable mosquito vectors raise the potential for further outbreaks in European countries. Public health officials are now on high alert, monitoring for any signs of local transmission. In response to these recent cases, European health authorities have ramped up surveillance efforts and implemented public awareness campaigns to educate residents about the virus and its symptoms. Additionally, guidelines for mosquito control and prevention measures are being reinforced to mitigate the risk of transmission. As the situation evolves, ongoing vigilance and collaboration among countries will be essential to prevent the Oropouche virus from establishing a foothold in Europe. Spread to Canada? No confirmed cases of the Oropouche virus have been reported in Canada. However, health officials remain vigilant due to the recent outbreaks in South America and Europe. The potential for the virus to reach Canadian shores is a concern, especially with increased international travel and the presence of mosquito species capable of transmitting the virus. Public health authorities closely monitor the situation and are prepared to respond if any cases arise. The risks associated with the Oropouche virus include the potential for local transmission and the strain it could place on healthcare systems. Preventive measures are crucial in mitigating these risks. Canadian health agencies have implemented surveillance programs to detect any unusual patterns of illness that could indicate the virus's arrival. Public awareness campaigns are also in place to educate citizens about the importance of mosquito bite prevention and recognizing symptoms associated with the virus. Canadians need to stay informed and vigilant. Keeping up with updates from health authorities and practicing preventive measures, such as using insect repellent and eliminating standing water, can help reduce the risk of any potential outbreak. By remaining proactive, communities can better protect themselves against emerging health threats like the Oropouche virus. First deaths in Brazil. The recent reports of the first recorded deaths caused by the Oropouche virus in Brazil have sent shockwaves through the public health community. The victims, both young adults in their 20s, were residents of a region heavily affected by the virus. They exhibited typical symptoms, including high fever and severe joint pain, but their conditions rapidly deteriorated, leading to hospitalization and, ultimately, death. These tragic cases underscore the potential severity of the Oropouche virus, particularly in vulnerable populations. One of the most pressing concerns surrounding the Oropouche virus is the lack of an effective vaccine. This absence poses significant challenges for public health officials, as it limits the options available for preventing infection and controlling outbreaks. Without a vaccine, the focus must shift to mosquito control and public education to reduce transmission risks. The urgency of research into the Oropouche virus has never been greater. Scientists and health organizations call for increased funding and resources to understand better the virus, its transmission dynamics, and potential treatment options. Preventive measures, such as community awareness campaigns and mosquito control initiatives, are essential to mitigate the impact of this emerging health threat and protect public health in Brazil and beyond. What is the sloth virus? The term sloth virus is a colloquial name for the Oropouche virus, derived from its association with sloths, which are its natural hosts. This nickname highlights the ecological connections crucial to the virus's transmission. Sloths and other wildlife contribute to the virus's life cycle, as they can harbor it without showing symptoms, allowing it to persist in the environment. Ecological factors significantly influence the transmission of the Oropouche virus. The presence of suitable mosquito vectors, particularly those from the Culicoides genus, is essential for the virus to spread. Additionally, environmental conditions such as deforestation and climate change can alter mosquito habitats, potentially increasing the risk of human exposure. Understanding these ecological dynamics is vital for developing effective prevention strategies. Recognizing the origins and transmission pathways of the Oropouche virus is crucial for public health efforts. Researchers can learn how the virus operates within ecosystems by studying its relationship with sloths and other wildlife. This knowledge is essential for predicting outbreaks and implementing targeted interventions to reduce the risk of infection in human populations, ultimately helping to mitigate the impact of this emerging health threat. Invasive mosquito species. The yellow fever mosquito, scientifically known as Aedes aegypti, is an invasive species that significantly transmits various arboviruses, including the Oropouche virus. This mosquito thrives in urban environments and is commonly found in tropical and subtropical regions. It breeds in stagnant water sources such as flower pots, discarded tires, and open containers. Its adaptability to human habitats makes it a formidable vector for disease transmission. The yellow fever mosquito contributes to the spread of the Oropouche virus by feeding on infected hosts and transmitting the virus to humans during its blood meals. This highly aggressive species can bite multiple times, increasing the likelihood of virus transmission within communities. The overlap of human populations with the habitats of these mosquitoes creates a concerning environment for potential outbreaks. Various measures can be implemented to control mosquito populations in affected areas. Community engagement in eliminating standing water, using insecticides, and promoting the use of mosquito nets and repellents are essential strategies. Additionally, public health campaigns to educate residents about the importance of mosquito control can significantly reduce the risk of Oropouche virus transmission, ultimately protecting public health in vulnerable regions. The Oropouche virus, also known as sloth fever, poses a significant public health threat, particularly in regions where it has recently spread. We discussed the alarming rise in cases, including the tragic deaths in Brazil, and highlighted the role of invasive species like the yellow fever mosquito in facilitating transmission. Understanding the ecological factors and the virus's origins is crucial for effective prevention and control measures. Awareness and prevention are crucial to mitigating the impact of the Oropouche virus. Individuals can better protect themselves and their communities by staying informed about symptoms, transmission methods, and preventive strategies. We encourage you to subscribe to our channel for more updates on health topics, ensuring you stay informed about emerging health threats and preventive measures. If you found this video informative, please share it with friends and family to help raise awareness about the Oropouche virus. Additionally, explore our content on the channel to deepen your understanding of other health issues. We can foster a more informed and proactive community facing emerging health challenges. Thank you for watching, and stay safe.